Inferior epigastric artery, please remember it. Now we are going to study about inguinal hernia. Now, inguinal hernia, I explained to you, it is very easy for you to divide it or classify it by the arteries or vessels known as inferior epigastric artery. Okay, so by the relation of the inferior epigastric artery, you can easily classify that inguinal hernia is inguinal hernia is medial
Direct or
or
indirect?
late. Yes,
Yes.
yes. So inguinal hernia, it is direct inguinal hernia or it is your indirect inguinal hernia. So please remember, I tell to you that indirect inguinal hernia, it is due to
Lateral.
persistent process vaginalis.
Process of originalis.
Okay, so persistent process vaginalis can also result in indirect inguinal hernia, and it is most commonly in young males. It is most commonly in young males. Direct hernia most commonly in old persons. Okay, so young persons, indirect inguinal hernia. Old persons, direct inguinal hernia. Okay, now the important point, relation of your inferior epigastric artery. So if you see here the diagram, this is our inferior epigastric artery. Inferior epigastric artery. This is our inferior epigastric artery. Now, in relation to these two arteries, we have to classify our inguinal hernia. Inguinal hernia. Now, if the hernia, it is lateral, if it is lateral to your inferior epigastric vessels, you will call it as indirect inguinal hernia. Which hernia? Indirect inguinal hernia. If the hernia is medial to the inferior epigastric vessels, it is known as direct inguinal hernia. Which hernia?
Direct inguinal.
Direct inguinal hernia. Now, see here. I am going to make here a diagram. This is our which ligament? Inguinal
Inguinal
ligament.
ligament.
Inguinal.
Okay. Now, please remember one important point here. The midpoint of your inguinal ligament, the midpoint of inguinal ligament, you can feel the pulsations of femoral artery. Okay, you can feel the pulsations of which artery? Femoral artery. And above to these pulsation here, this is your deep inguinal ring. Which inguinal ring?
Deep
Deep
inguinal ring.
inguinal.
Deep inguinal ring. Now see here. Here your arteries are present. Okay. So like this. So this is your inferior epigastric artery. Which artery?
Inferior epigastric.
Inferior
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 epigastric.
epigastric artery.
epigastric
You
artery.
already know that inferior epigastric artery is a branch of your which artery?
External
External
iliac
iliac
artery.
artery.
External.
External iliac artery.
External iliac artery. Now see here. If the hernia is coming out from here, from deep inguinal ring, passing through the superficial inguinal ring and into the scrotum. See, it is lateral to your inferior epigastric vessel. So this will be your indirect inguinal hernia. Which hernia?
Indirect
Indirect
inguinal
inguinal.
hernia.
Indirect
Indirect
inguinal
inguinal
hernia.
hernia. Now see here. If the hernia, now I am drawing here another diagram. This is your superficial inguinal ring. This is your deep inguinal ring. If the hernia, now, this is your which vessels? Inferior
Inferior
epigastric
epigastric.
Inferior
arteries or
epigastric.
vessels, right? Now see here.
Yes, sir.
If the hernia is bulging out from here, and now it is coming out from the superficial inguinal ring into the scrotum. Now this is your direct inguinal hernia. Which hernia?
Direct
Direct
inguinal.
inguinal.
Direct inguinal hernia. Now see here, very important point. How your direct inguinal hernia is forming. I draw one more diagram. This is what? Inguinal ligament, right?
Yes, sir.
What is this? Inguinal ligament. This is your anterior superior iliac spine. This is your pubic tubercle, right? Now
Yes, sir.
Yes,
here
sir.
a muscle is present. What is the name of this muscle?
Rectus
Rectus
abdominis.
abdominis.
Very good. This is your rectus abdominis muscle, right? Here
Yes, sir.
an
Yes, sir.
artery is passing. What is the name of this artery?
Inferior
Inferior
epigastric
epigastric.
artery.
Inferior
Inferior
epigastric
epigastric
artery.
artery. Now, if you see here in this diagram, a triangle is forming. See, what is the triangle?
Yes.
Inguinal ligament, rectus abdominis muscle border, and inferior epigastric arteries or vessels, right? This
Femur.
this triangle is known as what?
Superficial
Superior.
facial.
This is known as
Yes, sir.
Hasselbalch's triangle.
Hasselback triangle.
Which triangle?
Hasselback triangle.
Hassel's back.
Hasselbalch triangle. Now see here one another point. You have here, what is this?
Superficial ring.
Very good. This
Superficial
is your
inguinal ring.
superficial
Inguinal.
inguinal ring, right? Now this is a weak part. Okay, so this is a weak part. This Hasselbalch's triangle, it is a weak part. Okay, you remember I explained to you the conjoint tendon. So here
Yes,
the
sir.
muscle fibers are not present. Here the tendons are inserting into the pubic tubercle. So what happened in old age, the muscles and these tendons become weak, and now the hernia can bulge out from this triangle, coming out from the superficial inguinal ring and now into your scrotum. So this hernia, which is present medial to these inferior epigastric vessels, it is known as which hernia? Direct
Direct hernia.
inguinal
Direct
hernia.
hernia.
Which hernia?
Direct hernia.
Direct
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 hernia.
inguinal
inguinal
hernia.
hernia. So see this diagram now, everyone.